Welcome everyone to the March 27th, 2025 Enforcement and Compounding Committee meeting. My name is Maria Serpa, chairperson of the committee. Before we convene, I'd like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where protection of the public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. I'd like to recognize our newest board member returning, Ricardo Sanchez. Welcome, Ricardo.
Thank you.
I believe this was your old committee, so we'll catch you up with our work in the last few years.
Yes, thank you. Look forward to it.
Great. As I facilitate this meeting, I will announce when we are accepting public comment. I've advised the meeting moderator to allot 3 minutes to each individual providing comment. Throughout the meeting, at appropriate times, we will begin public comments for individuals attending in person, followed by public comments by individuals participating via WebEx. This approach is necessary to facilitate the meeting. Before we get started, I'd like to ask staff moderating the meeting to provide general instructions on the process for providing public comment via WebEx.
Good morning, this is the moderator. At the appropriate times, we'll be opening public comment and we will display instructions on the screen. If you would like to make a comment and you're on WebEx, you may look for the hand icon, which will appear at the bottom of your WebEx screen. If you're on a mobile device, that may appear behind the 3-dot other options icon. And if you are a call-in user, you may press *3 to raise your hand. At that point, each speaker will have 3 minutes to speak. I'll give a 10-second warning before your time is up. And we do ask that people's comments stay on topic for each agenda item. And we ask that people speak only once per agenda item. Thank you. And I turn the meeting back to Chair Serpa.
Thank you. I'd now like to take a roll call to establish a quorum. Renee Barker.
Licensee member present.
Thank you. Jeff Hughes will not be attending with us today. Sung Oh.
Morning here. Licensee member.
Thank you. Ricardo Sanchez.
Yeah, Ricardo Sanchez, public member.
Thank you. Nicole Tebow.
Licensee member present.
Thank you. Good morning, everyone. A quorum has been established. As I ask everyone participating today to be respectful of the work before the committee, we encourage participation by members of the public throughout our meeting at appropriate times. The committee respectfully requests that when comments are provided, they are done so in a professional manner consistent with how the committee conducts its business. Before we move on to the next agenda item, I'd like to remind the committee members participating via WebEx to please remain visible on camera throughout the open portion of today's meeting. Members, if you need to temporarily turn off your camera due to challenges with internet connectivity, please remember to announce the reason for your non-appearance when you turn off your camera. Okay, we'll move on to agenda item 2, public comment on items not on the agenda and items for a future agenda for future meetings. I now ask the moderator to open the lines for individuals to provide the opportunity for public comment on items not on the agenda. You're not required to identify yourself, but may do so. I'd like to remind everyone that the committee cannot take action on these items except to decide whether to place the item on a future agenda. Accordingly, if your comment pertains to an item on today's agenda, please save your comment for the public comment period specific to that agendized item. Members, following public comments for this agenda item, I will ask you to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, but rather an opportunity for us and members of the public to request consideration of an item for future placement on an agenda. At that time, discussion will occur. I'm not sure, I don't see, are there any members of the public in Sacramento? I'm just confirming. Oh, I'm not sure if they can speak.
It is my understanding there are no members of the public in the Sacramento location.
Okay, so going forward, should they just announce when we do public comment when there's someone there? Otherwise, I will not be going to Sacramento at each time.
Yes, and I'll be monitoring the public comment table as well.
Thank you. Moderator, we are ready for public comment on items not on the agenda from individuals participating via WebEx.
Thank you. This is the moderator. We've opened up the public comment feature to allow for public comment. If you'd like to make a comment, click on the hand icon. That's at the bottom of your WebEx screen, or if you're on a mobile device, it may be behind the 3 other options. And our call-in users can press *3 to raise their hand. Each speaker will have 3 minutes with a 10-second warning. First for commenting is someone logged in as Pat. And Pat, I'm going to send your request to unmute. And you're unmuted. Go ahead.
Now?
Yes.
Wonderful. My name is Pat Irving. I'm an RN with over 35 years experience in risk and patient safety. And on the October 16th meeting, there was discussion about adding education material to the script regarding increasing of the injunctive relief thresholds. And I saw that that did occur, and I want to thank everyone on the subcommittee for making this happen. It was a great article, and it's a big step forward because I think a lot of people did not know that they could, in fact, increase the thresholds. However, the board has heard on several occasions that this process can be problematic and it's not easy and it's not always timely. With that in mind, I would like to ask the subcommittee to do an audit before your next meeting on this process. And I'd like to request specifically that there be 2 questions asked to pharmacists. One, do they know they can ask for the increase? The second question is, if they have tried to ask for an increase in threshold, how did that process unfold for them? So that would be the audit. My second request is that there be some follow-up on the recommendation to work with the medical board and others, possibly on a future policy statement. All of this is extremely important, again, due to the harm being caused to the patients that you are dedicated to protect, the people of California who you're dedicated to protect. And asking for increase in thresholds is a critical action that all pharmacists should be aware of. Thank you so much.
Thank you.
And at this point, I do not see any further hand raises or requests for comment. Shall I close that public comment feature?
Please do. Thank you.
You're
Members, before I bring the discussion back to you, I did want to note that there is still work being done on developing a policy statement with other healthcare boards. That's still work going on. Members, do you have any items you'd like to place on a future agenda?
Hi, Maria, this is Nicole. Just relevant to that comment, I think it would make sense to keep this on the Education and Public Education Committee. I think it's something that maybe we could periodically remind people of, because maybe not everyone is bumped up against this, but will over time. So I think this could be a nice ongoing topic about the thresholds and reaching out. So I would suggest it for that committee.
Okay, thank you. Any other comments? Okay, thank you. Moving on to agenda item 3, approval of the draft minutes from the October 16th, 2024 committee meeting. Members, attachment 1 to the meeting materials includes a copy of the draft minutes from the October 16th, 2024 meeting. Do you have any questions or comments on the draft minutes? I would entertain a motion if you believe such action is appropriate.
Hi, Chair Shabbat, this is Song. So move.
This is Renee. I'll second that.
Thank you. With a motion and second on the floor, I now open the discussion for public comment on the draft minutes.
This is the moderator, and we are opening the public comment features. If you would like to make a comment, you may look for the hand icon and click that to raise your hand, or you may look for the, let's see, and our call-in users may press *3 to raise their hand. Are there any requests for comment? I do see a request from Pat. Pat, I'll send you the request to unmute your microphone and you'll have 3 minutes.
And can you
You're
hear me
unmuted.
all right?
Yes.
Wonderful. I hate to sound like a broken record. This is Pat Irving again. I'm on the minutes on page 4, paragraph 2. There is a statement that Ms. Lindell pointed out, I'm quoting this, that the injunctive terms were dictated to the wholesalers by the attorney generals, and that it's likely, therefore, that there's not going to be an opportunity to change them. I'm not saying, I don't remember it being stated quite this way, and a colleague and I heard more. What she was saying is that the wholesalers can't make a change, not the attorney generals. Having said that, we all know, well, we think we know, that the attorney generals might not be eager to make this change. However, what we're asking you is to protect the people in California. We absolutely must follow through. More of a communication, even if the attorney general say, we won't make a change. I'm not sure that they're aware of the harm that they're causing.
Excuse me, this is time to comment on the minutes and not to expound on them. Perhaps that could be at another time, but for right now, I see your correction to the minutes. Anything else about correcting the minutes?
It just had to do with the Miss Lindell's statement, and I didn't hear it the way it's recorded, and perhaps I heard incorrectly. That's all I wanted to say about the minutes. Thank you for listening to me. I
Thank you.
appreciate it.
And since Ms. Lindell is not providing this correction, I would instruct staff to go back and listen to her comments to correct that. Perhaps she was saying there's not likely an opportunity for licensees to change them. And we can make that correction should the recording show that. Is that appropriate, Anne and Debbie?
This is Anne, so we can work with council offline to confirm whether or not a change is appropriate to the minutes. Would you like to amend the motion to reflect that there will
amend the
be?
motion, yes, to reflect that we direct our staff to confirm that discussion on the last meeting, and that to verify the recordings and to confirm and amend as necessary.
Thank you. And who was the second?
Yeah, this is Renee. I'll second that correction.
Thank you. I think we were also in the middle of public comment, and we do have to go back to public comment since we have a new motion anyway. So let's go back and restart public comment.
Thank you. This is the moderator. If you have a comment on the motion about the minutes, you may look for the hand icon and click that to raise your hand. Our call-in users can press *3 to raise their hand. And if you are on a mobile device, you might find the hand icon behind the 3-dot other options. Are there any comments on the minutes? I do not see any requests for comment. Shall I close public comment?
Please do. Thank you.
You're welcome.
Members, unless you have any additional comments, I will now take a roll call vote. I don't see any hands, so we'll go ahead with the vote. Renee Barker.
Yes.
Sung Oh.
Yes.
Ricardo Sanchez.
Yes.
Nicole Tebow.
Yes.
And I vote yes. Motion passes. Thank you. Next item is agenda item 4, discussion and consideration of implementation of Assembly Bill 1902, prescription drug labels accessibility. Members, you may recall during our October 2024 meeting, the committee discussed possible implementation activities for a number of measures signed by the governor, including AB 1902, a measure related to prescription drug label accessibility. During our initial discussion, there was some discussion about the need to develop regulations to implement the requirements. Today, we have an opportunity to continue this discussion. You will note that the meeting materials include some questions intended to assist the committee. I intend to discuss each question as a committee, then open up to public comment. The law specifies that the accessible prescriptions be made available in a timely manner comparable to other patient wait times. Our first question, I believe we have a slide with the questions. Thank you. Our first question for consideration is if the board should define in regulation the phrase, quote, in a timely manner comparable to other patient wait times, end quote. I agree with the notes from staff that if we believe a definition is appropriate, we may need to provide different provisions for the various types of pharmacies business models, such as retail, closed door, mail order, etc. Members, I welcome your comments on this first question, and it's on the screen.
Hi, Chair Serpa. I am just flagging for our moderator. For some reason, I don't have a raised hand during the non-public comment period. Just wanted to let you know. So I'm just going to speak up.
Yeah.
I have a lot to say on this topic. I have a lot of strong opinions. So I'm going to just start here because I was prepared on last January meeting that we had canceled. So,
Yeah.
So I'm going to start by saying completely appreciate the intent and what this bill is attempting to do, which is to provide a lot of accessibility to folks who have, visual impairment, which we completely wholeheartedly respect. And I am just, glad for the intent. However, I am deeply, deeply concerned about the true practicality and how to make this a possibility from a pharmacy who fills one prescription a day to a pharmacy that has 8,000 stores. And, this question is a really good question. And I ponder about for a long time, and I ponder longer than I could have had to because our meeting was canceled. And from that on, what I came down to, and I'm curious to hear what other members, is that I think it is really probably a better approach for us to provide this as in a more of a policies and procedure for the business to determine how best to provide this service. And I just don't think that at this point, timely manner can be defined. I don't think that we need to go down the rabbit hole of defining timely manner for a mail order pharmacy. And then I think then the question is, well, then how do you define a mail order pharmacy? And then also the rabbit hole of, okay, well, you're a one pharmacy, a small pharmacy in the rural, some part of the town somewhere in California. And how are they going to, right? So I think that this really should be more of a policies and procedure decision based, and that what we can do is to require policies and procedure that defines how the business will provide it. And obviously timely manner should not be like a month. I don't think that's appropriate, but I don't think that it should be an hour. I don't think it should be 7 days. I don't think it should be a day. I think that businesses will have to decide how they can really do this. And I think the intent should be that they are aware they need to do this and that they know how to provide it. I've been lucky enough to be involved in the discussion with some vendors for my organization, and it is a process, as you can imagine. It costs about $10,000 to $20,000, and there's annual subscription that's required. So I'm being very mindful and saying this with a deep concern for a very small, tiny pharmacy, how they're going to comply with this, and that we really need to be mindful of that. And so I'm going to leave that there. So I don't think that we need to define it as in the traditional sense of regulation. I think that we should take this approach more of like a regulation that we have for pharmacist absence, right? 30-minute lunch absence. The policies need to define how you're going to do it, and certain, kind of like that way. So that's my 2 cents, and I'm going to stop talking for now.
Thank you, President O. Nicole, I see your hand. Now we have hands.
Yes, thank you. Yes, I got added back. I wanted to kind of echo what Sung was saying, that, yeah, I think this is great. I was really excited about this law overall, but I don't know that there's a ton of availability of the products yet. I'm hoping that maybe they will follow because of the law. But yeah, most of what I could find, a lot of it, you have to send something away and then get something back. And so because of that, I can't necessarily turn it around in the same time I can you know, just another prescription. I wanted to bring up too, like maybe in our policy or the way we do this, is there a waiver or an exception? What if we get an antibiotic? That patient needs to take it today and they usually use this service, but you counsel them and they feel comfortable that they can do it while you work on getting them the other piece. Like, I don't want to hold an antibiotic because I don't meet this piece of it for a patient. So that's what those are my concerns. I don't want it to become a barrier to patient access either, like accidentally. I hadn't thought about the approach that Sung brought up, but I think that makes a lot of sense.
Thank you. Any other comments from members?
Hi, this is
Okay.
Renee. I'll talk and put my hand up at the same time. And take it down. No, I just wanted to say, oops, sorry, delay. That I really completely agree with the, now like not trying to be so prescriptive into the time because there's so many variabilities. I think that will be difficult to put, like, I mean, I don't think it can be in a regulation, but I think it can be like Sung offered the suggestion, that, per SOP, policy SOP for the pharmacy because of the variability. And even, for pharmacies, I mean, there's extreme variability day to day. So, how to address that type of turnaround time as well. So, yeah, I would definitely agree, and also with Nicole.
Thank you. So don't feel any pressure, Ricardo. You don't have to jump in, but I just wanted to give you the opportunity to raise your hand. Does your hand work?
Yeah, it does. Everything's fine. I'm just listening.
Okay,
And,
great. So I think on this question, I totally agree with the format that the President O mentions, because in fact, if you look at our work over the last couple of years, that's been the direction that we're going in, to provide that the intent is met, but that the facility needs to have some documentation on how they interpret that and how they meet that. So we certainly could work on asking to provide a procedure or an SOP that defines that defines timely manner and that defines timely manner. And we just stop there at that point, because I'm sure we'll have further discussion once we have some regulation language. We can dive into the weeds, but that sounds like that's the direction we want to take. So members, if you have anything else to say, I'll open up for public comment. Moderator, we're ready for public comment for people participating via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment, you may look for the hand raise feature. It's a little hand icon, typically at the bottom of the WebEx screen or behind the 3-dot other options if you're on a mobile device. And our call-in users can press *3 to raise their hand. Each speaker will have 3 minutes with a 10-second warning. And our first hand raise is from John Gray. John, I'll send you a request to unmute your mic.
Hi,
You're
good
unmuted.
morning. Thank you. Yeah, this is John Gray, registered pharmacist with Kaiser Permanente. Thanks for the opportunity to comment. Just wanted to say we think the approach that the board members are proposing here, policy and procedure-based approach to defining timely manner, is really rational. I think that's a good direction to take if the board decides to write regulations on this law, to clarify this law. And I think what we hear, what we've been hearing from the board members who are practicing pharmacists who spoke up about this is the tension between what the statute says, that the prescription with the accessible label needs to be available to the person in a timely manner comparable to other patient wait times, and the fact that to generate an accessible label or even a translated label just takes more steps, right? Like, as practicing pharmacists, we all know that oftentimes you have to go into a second system, retype information, revalidate information. And so it just feels like there's a lot of tension between what the statute actually says and the facts of pharmacy operations and how you would go about doing this. So, another thing that the board might consider would be whether to ask for some cleanup amendments to the statute itself. It might, the statute might be improved by saying something like, the prescription needs to be available to the person in a timely manner that does not result in any unnecessary delay in the person receiving their medication. From an enforcement perspective, the board already assesses for unnecessary delays in providing a prescription to a patient, whereas it might be more difficult to apply the standard of comparable to other patient wait times, particularly recognizing that tension that you all are speaking to. So I think those are my comments on this part. Thanks very much.
Thank you, Dr. Gray.
And this is the moderator. Next comment is from Sean Kim. Sean, I'll send you a request to unmute your microphone and you'll have 3 minutes. You're unmuted. Go ahead.
Can you guys hear me?
Yes.
Yes.
Okay, this is Sean Kim from California Pharmacists Association. Thank you so much for allowing me to provide comments for this topic. CPHA respectfully requests the board to grant an exemption for non-chain pharmacies from AB 1902, as a lot of board members already mentioned. While we strongly support the improving access for patients who are blind and visually impaired or have limited English proficiency, this bill poses serious challenges for independent pharmacies or non-chain pharmacies. Unlike large chains or mail order operations, independent pharmacies and non-chain pharmacies don't have the same infrastructures and resources. Complying with AB 1902 means investing a specialized technology, as we already discussed, and additional administrative processes. Non-chain pharmacies are already under immense financial pressures. For many, the volume of the patients who would benefit from this service is extremely small and making the investment disproportionately burdensome. The cost of compliance could result in reduced services, increased prices, or even pharmacy closures in underserved areas. CPHA urges the boards to recognize the unique position of non-chain pharmacy and grant a targeted exemption. This would ensure we continue moving towards the health equity without unintentionally harming the pharmacies and the patients rely on most in their communities. Thank you so much for your time to listen to the comments.
Thank you.
And this is the moderator. At this time, I do not see any other requests for comment. Shall I close that public comment feature?
Please do. It looks like board members wanted to provide additional comments. I saw President O's hand go up first.
Thank you, Chair Serpa. I appreciate it. Just wanted to, I'm obviously not an attorney, and Anne at least can't kick me under the table here because we're virtually meeting, thank God. But I don't know, probably legally that what CPHA is speaking to is probably a little hard. How the law is written is what I'm getting out of probably. Now, can we evaluate that at least? So that's a request, if possible, which I'm guessing most likely it's not, but I'm not an attorney. So let's check that. Two, though, is it at
President
least
O?
possible? Hello?
Sorry, can you hear me? This is Corinne, board
Oh, hi,
counsel in the hearing
Corinne.
room.
Oh, you're here. Oh my God. Are you going to provide the on the spot like response? I would be very excited to that. Go ahead, Corinne.
Yeah, no, I just wanted to chime in. I mean, I do believe that there may be an issue, with the board granting an exemption in the way that's being discussed. I think that might probably exceed the board's authority as regards this specific law. I think you'd have to look at it more as an enforcement discretion approach as opposed to granting an exemption.
Okay, thanks, Corinne. That was my gut feeling, unfortunately. But okay. But anyway, you guys can look more into it, hopefully. However, now, I was thinking also, is there a possibility that the regulation could specifically state that as long as a pharmacy has a way, meaning not that the pharmacy, but if the pharmacy develop a way to work with another pharmacy who may be able to provide a services that satisfies the requirement of the law. Maybe they can provide like a co-op of pharmacies to provide, you know, if oh, I go to Song's pharmacy and I'm like, oh my God, you know, I just have no way to do this. But if you go down to the Nicole's pharmacy down the hall, they have a way to do it. Would that meet the intent of the law? Can that be something that regulation can specifically allow under their policies and procedure or the agreements that's in place? That's a question again. I don't know the answer, but if legally that's allowed, I would like to also look at that, explore that possibility. Thank you.
Thank you. Nicole?
Yes, thank you. And I don't know if this would have to be an amendment or how this would work, but I just wanted to point out it really needs to be done in such a way that there is input from the patient. You know, everyone with a disability, even two people with the quote unquote same disability, are different and have different needs and wants. So there needs to be a level of input from the patient that the patient can say, no, I don't want to wait the extra time for this. I just want to be given it and be counseled or things like that. Like it shouldn't be that a patient has to receive these things if they choose not to. And you need to be able to pick which, they need to be able to choose which thing that they want. You know, not everyone reads Braille just because they're visually impaired versus, you know, a verbally one of the verbal labels that talks to you and different things like that. Someone could be both visually and hearing impaired. So, you know, we would definitely want to make sure that the patient has choice, both whether or not to do it and then what option to choose.
Those are both excellent points, and the public comment was very good too. So we'll take those things into consideration as we move forward, and probably are going to promulgate some regulation about a policy statement or an SOP, and we can include those comments in that discussion when we get into the details of it. But this overall discussion, I think, is very helpful. Members, any other comments before we move on to the next question? Great, thank you. Next for our consideration are a series of questions surrounding the measure's requirement that accessible prescription label must be appropriate to the disability and language of the person making the request. The first question, so you can see there's 4 questions there, A, B, C, and D. The first question posed is if the board should further define the regulation, how a pharmacy will determine what is appropriate for the disability. I believe that it may be appropriate to consider a requirement for the pharmacy to develop a policy, again, like we said before, developing about how it meets its requirements. Such an approach will allow each pharmacy to develop a process that works for their business model, similar to the response that we had to the previous question. But looking at these 4 questions, sorry, we're just going to look at the first one, policy number A. Members, do you have any questions, any comments about A? And we'll take them individually. So we're just working on A right now. Oh, I didn't see who was first. Let's go with Nicole first.
Nicole was first.
Thank you. Yeah, sorry, I was a little ahead of myself. This is kind of what I was speaking to in the last one, that I don't think the board should define how that we will determine what is appropriate. Again, I think, or maybe we can, but it is like that you have a discussion with the patient or the caregiver to determine. I don't think we determine for them what is the correct. Maybe there could be guidance on how to decide, but I think the patient has to have input here.
Thank you. President O?
Thank you. I agree with Nicole, and I agree with your comment. I think it should be something like a business will decide, and a policy could say a business will decide if patient requests this, how, what is it that they would they would like to be provided with. Now, the question is that legally it says audible large print braille or translated direction. So I think that that's a question for the attorney. Is the pharmacy who's providing the service need to do all 4? Does the availability have to be all 4 if patient wants one of those? or can they do just one, and that would meet the requirement of this legal requirement? And I'm probably going to lean toward, I'm not an attorney again, but to the latter because of the way that it's written. But again, I don't know. So that's probably another question.
Okay, thank you. We're gonna, as a board, discuss each of these sections and then open up the public comment. Oh, I'm sorry, Renee, you had a comment about A?
Yeah, I just sort of in following, I mean, I think, this, I don't, is this just semantics? But, this is how pharmacy will determine what's appropriate to the disability. And when you refer that a business will decide, and we've been having conversations about standard of care. So, like at what level is this decision being made? So maybe, again, could still be addressed by the SOP, but it does seem that it would be, I mean, it's going to be the pharmacist who is in many cases face to face with the patient, who will best be able to decide through whatever communication means they have with that patient what will be appropriate, or have somebody there. And I guess I'm just trying to get at, sometimes we're not wanting it to that decision with the patient to be moved far away from the pharmacist.
Good point.
So I just want to add that distinct, if that's even a distinction, then what's being suggested. But I mean, I would advocate for that more of a standard of care determined by the pharmacist. It may be a larger business model, if you will, to all the options that you could have available. But I think I see what Song is saying, for each patient, do you have to have that all available? But it seems you, in some ways, working towards having all of those options available, right? Because of, as Nicole mentioned, you don't know who's going to come in and have what they're going to need, right? And so, I think it should just be, well, back to A, but just that it's the pharmacist determining.
Ricardo?
Yeah, I also agree. I think we should leave it up to the pharmacist dealing with the patient, and we should stay out of that. I mean, it just seems that everyone patient is going to be different, and the best person to determine what's appropriate would be the pharmacist. I agree with that.
Okay, thank you. Let's move on to B, which is related to this, but should the board establish a minimum font size to define, quote, large print, unquote? I believe that it may be appropriate for the board to establish what is a minimum size for a large print. I'm hoping that the public comment will help to provide some suggestions on what a minimum font size should be. Members, do you have any comments on B? Renee?
I think I would like to refer to an organization that better defines what these terms are. I mean, that's what we would refer to. Because I think in the I'm looking at the bill here, and they mentioned, well, this is format specific practices, but it says United States Access Board and the National Standards of Culturally and Linguistically Appropriate Services class. So, I'll be honest, I'm not sure that they refer to, like minimum font size, but it seems there may be a standard established somewhere else that would be referred to.
Okay, that sounds
So, yeah, thank you.
President O?
Thank you, Maria. I would just echo Renee's comments, but also just to add, I don't think that our regulation should add another layer that is more unnecessarily going to complicate this situation, because most providers of these services, which there are few already, they already know what's the required. So I think that I don't want it to be a situation where if the standard changes and then our regulation has to change just because of it says it has to be 20 font of Arial, whatever it may be. So again, I'm keeping it simple, just kind of like just nimble and standard of care kind of a model here, which I just think that it should be simple and nimble. So that's I don't think we should.
That's an excellent point. Ricardo?
I just think if it's not broken, just let it be, leave it the way it is, not complicate it.
Okay. Any other comments on B? Okay. Next question for our consideration is if the board should specify the accessible label needs to be in the board's patient-centered format, or if the board can provide some flexibility to pharmacies to determine how best to meet the individual patient's needs. This one's a really interesting question because I'm leaning towards providing flexibility for the pharmacies to determine how best to meet the patient's individual's needs, especially if compliance with the board's current patient-centered label requirements with larger fonts and everything else that's required would make it more difficult ultimately for the patient. Members, I'm interested in your comments.
Hi, Maria. It's
Sorry, I
Nicole.
was on mute. Nicole?
Oh, no, it's okay. Yeah, where my brain goes to this right away is to think of the spoken labels. And if we did the patient-centered label, would it have to read every single thing when maybe the patient just wants it to say what drug this is and how to take it? Because you wouldn't want to listen to the entire label being read every single time. Plus, presumably that adds cost because it has to have enough capacity to do all those things. So I'd be interested to hear what people feel about other things, but I lean towards flexibility because you don't want it to burden the patient. You want to make sure they get the information that they need promptly, is my thought.
Thank you. President O?
Thank you, Chair Serpa. I agree with Nicole. We're all on the same page today. That's exciting. But really, I agree. I just think that it needs to be not as scriptive onto this because there's just so much variability.
Mm-hmm. So I'm sure, go ahead, Renee.
Yeah, just, again, I think I referred to this one when I was, for my last comment, but so whatever would, in terms of who defines, or who tries to define, the size of print, but, and for this one, when, in the actual regulation or the AB section, it has, that it conforms to the format specific best practices. So even that is not a very something that's best practices is like a recommended, but not a hard and fast. And so I think there could be policy SOP referring to what options there could be based on what, this class has. But I think, yeah, I'm totally in agreement not to dictate any specifics about this in a regulation.
I agree. I think that providing the flexibility, we also need to, in our discussion, when we look at the detail of the language, assure that the label that is provided to family, that's easily read by family members or healthcare practitioners or other people other than the disabled person. So that needs to be still available so that others could read it. But also maybe, one of the points that Nicole made about the spoken label, maybe we also, I don't want to get into the weeds here, but my consideration is about what parts of the label would not necessarily need to be read, and if it's only the drug, the dose, and the frequency, Maybe the indication won't be read, or, I could see how some things could be shortcut. And so we just need to be very careful when we go into the details of this, that we don't open up any unintended consequences or loopholes. So I think this will be a very interesting discussion when we get down into what the proposed regulation will actually look like. Members, any other comments on number C or letter C? Okay. Let's see, I kind of lost my space here. It looks like D, staff note. Okay, so it doesn't. The staff recommendation at a minimum that the board should require pharmacies to develop policies and procedures. This is kind of what we've been talking about. So section D really talks about that in more detail. Members, do you have any additional comments to D? We've kind of been talking about D throughout the discussion anyway, but do you have any additional comments or concerns? Okay, seeing none. Moderator, we're ready for public comment on policy question 2. So that would be for A, B, C, and D. Policy question 2. Are there? I don't think there's anybody in Sacramento, so let's go ahead to WebEx.
This is the moderator. If anyone would like to make a comment on the policy items A through D, you may look for the hand icon and click that to raise your hand. Our call-in users may press *3 to raise their hand. And if you're on a mobile device, you might find that hand icon behind your 3-dot other options. And I do have a request for comment from John Gray. John, I'll send you a request to unmute and you'll have 3 minutes.
Hi, good morning again. Thanks for the opportunity to comment. John Gray, registered pharmacist with Kaiser Permanente. Again, just want to say I concur with kind of the direction that it sounds like the committee members are taking, that and I'm going to sound a bit like a broken record from other discussions on other regulation issues, but where there's a national standard, that it makes sense for the board to adopt that national standard whenever possible. And so this feels like a situation where that is the case. And given that, and given the fact that so far the discussion has tended towards recommending a sort of policy and procedure based approach to a potential regulation, I would just encourage the committee members to consider whether a policy and whether a regulation to clarify this statute is necessary at all. Does the committee feel a regulation is necessary to say pharmacies are required to have a policy and procedure to describe how they will meet the requirements of this law? Because during routine inspections, an inspector could just as easily assess a pharmacy's preparedness to meet these requirements. And then I'll just share, one of the committee members asked how, if any organizations could share how they define large font. Just looking at our materials, kind of our default definition for large font is either Arial or Verdana font, 20-point font size for document headers, 18-point font size for the body of the document. So I think that comprises my comments on this item. Thanks very much for the opportunity to comment.
Thank you, Dr. Gray.
And this is the moderator. I do not see any other requests for comment at this time. Shall I close the public comment feature?
Yes.
Oh, hang on one moment. I'm sorry, I missed Sean Kim. Sean, I'm going to send you a request to unmute.
Thank you, board, for letting me comment on this discussion. And we really appreciate coming from CPHA that respecting the standard of care and then being able to practice on our top of experience, education, and training. And with that, we'll be able to make the judgment call for like what it should be, because it depends on the patients and the medication that we dispense. It'll be all different. The font size 20, it makes sense for certain medications when it has enough space to provide a label, but it might be different for different products. So thank you again for providing us the perspective on standard of care. And I think this is similar to the other conversation with compounding regulation that we've been talking about, but AB 1902 will be similar to the discussion of standard of care. So thank you again.
Thank you.
At this point, I do not see any further requests for comment. Shall we close public comment feature?
Thank you.
You're welcome.
Okay, members, the final area identified for our consideration is related to the requirement for accessible prescription labels to conform with the format-specific best practices established by the United States Access Board and the National Standards for Culturally and Linguistic Appropriate Services. Members, do you believe the board should establish a requirement for these pharmacies to provide education to pharmacists about these standards, or perhaps a requirement that the pharmacy designate a pharmacy personnel responsible for ensuring compliance with these tenets or of the national standards? Members, you can see policy question 3. I'm interested in your thoughts. President O?
I do think that it is, again, I think this needs to be left up into how the business is going to provide it and the trainings. I just don't think that this fits into the regulation. It just creates too much confusion. So I think that this should be left up to the policies and procedure to determine, because I would imagine that any policies and procedures employees would be getting training anyway. How to handle this should be in the policies and procedure. And so I don't think that this should be in the regulation. Now, I would like to add, though, to the comment in some way, I think there is a benefit to the regulation, even though it may be very simple regulation, just because we do not come across like we're not caring for this, or that we do not want to come across for the licensees to not be able to really comply, right? So then if we do not say anything about timely manner, then it really is kind of unclear what that means. Like we can't just decide what that is. So I think that if we at least say the businesses can decide based on their policies, then we can at least go by there and make sure they have some sort of a mechanism to provide services. So, you know, I'm all for keeping it simple, but I do think there is a little bit of value in developing regulation.
Thank you. Ricardo?
Yeah, I'm hands off of this. If anything, you know, put a link up to give the pharmacists the information so they could read up on it, but to dictate any of that, I think is too much.
Mm-hmm. I think just to follow up on here, I'm kind of torn. I know we'll have future discussion about this. Whether we can include, sometimes legal opinions say that we cannot include examples. So, you know, resources, examples, but maybe this kind of thing could be in an FAQ as we roll out the regulations as resources where people could look, because I'm not sure everyone would know their resources. But I certainly don't, I certainly agree that we shouldn't dictate which resources people use. But I'm looking forward to the future discussion as we get into the specific wording for this section. Members, any other comments about policy question 3? Seeing none, moderator, we're ready for public comment via WebEx.
If anyone would like to make a comment on policy question 3, you may look for the hand icon and click that to raise your hand. Our call-in users may press *3 to raise their hand. Are there any comments on issues 3? I do not see any requests for comment. Shall I close that feature?
Thank you. Yes. Okay. Thank you, members, for this very robust introductory discussion. Do you have any additional thoughts? I want to give you a moment if something else came to mind. Going forward, this topic will be brought to the full board as part of our committee report. Following discussion by the full board, if there appears to be general agreement from the members, I can work with staff on developing some proposed regulation text that we can consider at a future committee meeting. So that's the next steps. Members, any other final comments? Okay, moving on to agenda item 5, discussion, consideration, and possible actions on updates to self-assessment forms incorporated by reference. There they are. Next for our consideration are updates to various self-assessment forms. As the meeting materials indicate, the board previously approved a number of changes to these forms based on the changes that became effective in 2024. Regrettably, many of these changes are still not yet final through the rulemaking process. So when you looked at the attachments, you will see some of these previously board approved changes on the draft forms still in track changes. Today, I recommend that we focus our discussion on the new proposed changes that update the drafts to include changes effective in 2025. President O, did you want to, before I finish the introduction, did you have something, or are you just?
Sorry, go ahead.
Okay.
I was being very,
I
I
was on the right
had
track
a
for
lot
the
to say.
president.
Thank
Okay.
you.
Today, I recommend that we focus our discussion on the proposed changes that update the drafts to include the changes effective in 2025. This is noted by track changes in blue or highlighted in yellow. So just to be clear, the forms that we're looking at have a lot of track changes, but they were from the 2024 that the board has already approved. Today, we're going to be focusing on the new changes that are either highlighted in blue or highlighted in track changes in blue or highlighted in yellow. If we believe that the proposed updates are appropriate and the board agrees, staff will work to post the newly updated version of the board's website and will work with council on the best path forward to update the rulemaking process for those forms that require updates via regulation. So once again, we're kind of stuck in the making changes to something that's in the process of making changes already. So it is a little bit confusing. But I did want to remind members that included in our sunset report is a proposal to pursue statutory change to establish self-assessment process in statute. Should that occur, we will hopefully be in a position to implement updated versions of the self-assessment forms in a more streamlined manner. So if that passes through the sunset process, our self-assessment forms will be not stepping on, or the versions will not be stepping on each other. So I'm looking forward to that discussion. We will begin our discussion with the proposed changes to the community pharmacy and hospital outpatient pharmacy self-assessment. To aid us in our review today, I'll walk through the changes with you, and you will note that the meeting slides also refer to the substantive changes. So I think we're ready. This will help us walk through since there are so many changes on the attachments. The first changes are included on page 7 in blue ink, so you could see it projected also. The provisions are related to the new provisions related to notification of pharmacy closures. While I agree that staff have updated the form to accurately reflect the legal requirements, I believe we can probably streamline the language in the form and not list so many details, but only focus on the requirement to report to the board. My suggestion is that we simplify the proposed language on the form to be more of a general discussion on closure notification requirement. If the committee is agreeable, I can work with staff before the board meeting to make this change. So my suggestion is to really make this a lot less and just talk about closure and not the details. The next change is in section 6.13, which reflects the extension in the authority for pharmacists to furnish COVID-19 therapeutics. See that there? Further, in section 11.7, excuse me, includes the provision for a pharmacy to include as part of a consultation for a veterinary prescription, the option for the representative of the animal patient to receive drug documentation. That's there. The next slide includes new section 13.31, which includes provisions related to implementation of 1902. Deja vu, we just finished talking about that. I suggest that we simplify the language on the form to reference the requirement, but keep it general. So very similar to what my previous recommendation is, especially since we're still discussing how we are going to implement 1902 as we discussed in the prior agenda item. So again, if the committee is agreeable, I'd like to work with staff to develop language to really streamline this and not be so detailed. Members, I recommend your thoughts on the proposed changes to the community pharmacy / hospital outpatient pharmacy self-assessment. Members? President O.
Hi, Chair Sarpat. Thank you. So I have, I really took a deep dive into, I do this every couple of years, but also like just, you know, I took a real deep dive just for the process question. I don't know where this regulation package is, and I don't want to step on this complicated step of how to fix it. Now, can we talk about, is it possible? I'm gonna ask because I have a lot of kind of a formatting and kind of a reorg of overall that I would like to work with staff to really kind of dive down into it. If members are agreeable or you're agreeable, I would actually like to work with Anne and kind of go real deep dive into this and then make that all consistent to all other forms. So there's some things that I would like to be able to add if applicable, or that the boxes just says box under pharmacist, but it should have yes, no, or not applicable, because not all pharmacists does all the things listed under there, for example. So that's one. So it's a bigger picture question, if that's agreeable to members, for all self-assessment forms. And I'm saying that because I'm hopeful that assuming that we are successful next year, that all the changes that I would like to make could be more of a streamlined process so that, you know, this regulatory limbo is not a problem. So that's why I really took a deep dive, because now if we can be successful next year, that I think all the changes that I would like to propose to just kind of make it look really better, consistent, and all harmonizing, I can work with Anne on that on the background, not on during this public meeting. So with that, oh, go ahead, Maria. Go ahead.
No, I was just going to respond to you.
Go ahead.
You want to, it sounds like you have additional comments.
Oh, no, and then I was going to move on to some things that are policy discussion that we have to have.
Okay,
Yeah.
so just for process, I would like to respond a little bit to that, because I totally agree with you. Especially a couple of the other self-assessment forms, I've had a similar discussion, but because we're in the middle of the regulatory package, we're kind of not able to restructure everything to make it, you know, and eventually we also have a suggestion that all these forms be online, and there'd be click boxes and those kinds of things. So that's also in the process. So your yes, no, and not applicable, I believe, and we could check with Anne and the attorneys, but I believe those are non-sub changes. We probably could make those kinds of changes really easily and not interrupt the regulatory process. But the actual restructure and reorganization of all the forms, I'm hoping that we can do once the sunset package passes, to allow us to not, this is not the first time that we've run into, and actually in the ADDS form, we've run into having 3 versions of the regulations. And so we're making changes to changes to changes, and it gets to be very complicated. And so I'm hoping we can finish all of that without starting over. And then we could start over once we have the authority to do via statute, if that's okay.
Okay, that sounds good. And so then my next question is, are we only allowed to talk about blue today, or are we actually allowed to talk about?
So my understanding is this is the opportunity to make additional changes to the regulatory package. So what they focused on was the 2025 changes.
Right.
And I believe, Anne, we can talk about the other things too, but Anne, go ahead and clarify. We can add more changes?
Yeah, so I would be a little bit cautious here. I'm hopeful Jennifer is available as well, because we did do a public comment period and the board will be considering those comments, I believe at the April meeting, it's a little bit awkward to be considering outside of the full board those comments on the regulation text that was released, if that makes sense.
So would you suggest, and in that case, that we actually, anything that's not blue, we talk about it at the full board meeting? And you're muted.
I think probably need to defer to Jennifer.
I would say to discuss it at the full board meeting.
Yeah.
But
that
it can
sounds
be,
better.
it can be brought up and addressed a bit today. You could mention potential changes, but the full discussion of any of that would have to be at the full board meeting.
Okay,
sounds
in,
good. Yeah.
that makes
So-
it easy for today then.
Well-
In that case, I do agree with you, Chair Serpa, on 1.27. I think that really should not have all those things for pharmacy closure. I think it should just be a general statement. Businesses is aware the requirements in case of pharmacy closure, the notification requirements and all the stuff, because the requirements are even different if you're a chain pharmacy versus non-chain pharmacy, from my understanding. All the organizations that you have to respond to are different. I think that this is just a little too much for a situation. It's kind of like the pathway, the blood clotting thing that we had for self-assessment for so many years, that it was such a small population. I think that this is very important considering that pharmacy closure is a real issue. But I think it just needs to say that, you know, we're aware of it. So going down the other blues, 6.13, I think that that's okay to leave it there. I'm hoping that we can just strike that out in the future, but for now, I don't think there's any other way if we want to have anything like that. And let me see any other blue. Again, I agree with you on 13.31. Keep it general while we may have a regulation or some other way. And is that the only blue left?
Yes.
Okay, yeah, that's it.
Thank you. Any other comments from members? So just to clarify, this will be discussed again at the board meeting and get the board's approval. So I'll be ideally working on making some changes that I will present to the board. So at that point, you will see the final language, and then the board can discuss the final language for 1.27 and 13.31. Members, any final discussion on this before I go to public comment? Okay, I think we're ready for public comment via WebEx.
Thank you. This is the moderator. If anyone would like to make a comment on item 5, you may look for the hand icon, typically at the bottom of the WebEx window, or behind the 3-dot other options if you're on a mobile device. And our call-in users can press *3 to raise their hands. Any comments on this issue? I do not see any requests for comment. Shall I close that feature?
Yes, thank you.
You're welcome.
Okay. I'm going to move on to inpatient hospital self-assessment. Let's see, is that the right one? We're getting there. There it is. Changes to this form are limited to adding a new section 23.13 related to the new provisions of AB 2115, allowing for the dispensing of a 72-hour supply from hospital inventory, consistent with the federal 3-day rule changes for patients awaiting referral for treatment. These changes displayed on the slide for ease in reference. I would suggest that the language needs to be tightened up a bit to explicitly remind the reader that providing such a medication must comply with the legal provisions such as labeling and documentation requirements. I'm happy to work with staff on this additional language if the committee is agreeable. So I just wanted to clarify that, because as I read this, it misstates the intent, and it says that the I'm gonna have to look really close here, that the practitioner can dispense from hospital pharmacy inventory directly to the patient. That kind of implies bypassing labeling, bypassing the pharmacy documentation, and that's not the intent. And so I didn't want that to be confused. And so I'd like to work on tightening up the language to talk about that it be in compliance with other legal provisions. And so members, if you're agreeable with that, I can work on making those changes so they'll be ready for the board meeting. Okay. The next one is 2417. I'm also unclear about the applicability of the provisions in this section 2417 to an inpatient hospital pharmacy and would recommend removal of this provision from this self-assessment form. So I'll give you a moment to read that. So with those two areas, members, do you have any thoughts on the proposed changes to the inpatient hospital pharmacy assessment form? Renee?
Yeah, I just have a clarification of kind of where these are at in terms of, so when you, this isn't about this edit. This, I mean, I don't have any comments about this particular thing on the slide, but I'm just wondering, in the hospital self-assessment form, so I know these are old. I know currently there's a 2022 draft version that's been in use, you know, having been used by the hospitals, my experience. And so it refers to, I guess this is, so it just refers, so this self-assessment form has a section that just says, it's on page 30, where item 28 just says compounding. And it says prior to, you know, that to complete the compounding self-assessment. The compounding self-assessment is entitled, you know, on the website it says compounding, but then it's community pharmacy and hospital outpatient pharmacy compounding self-assessment. So is there some alignment happening with like having, because I see that the updated name for the previous one we discussed is community pharmacy and hospital outpatient pharmacy self-assessment. Compounding has been removed. Is there a separate compounding self-assessment name? Is that, I mean, am I missing something?
I see the part of the challenge is that we have so many versions of this, but maybe Anne or Jennifer can speak to, would that be a non-sub change to update the names of the forms? Because some of the form names have changed. Or does that be something that we go to the entire board to talk about?
It would depend, sorry, this is Jennifer. That would depend on what the particular regulation section states and the form that has been in use is currently in use. It would be something for the board to discuss further, but depending on what is stated in the regulation and on the form, it would probably be something the board would have to discuss the full board meeting.
Okay, so Renee, can you put a pin in that and bring that up at the next board meeting? And that maybe at that time we can actually like have more background information to show what the regulation is, what the current form is, and whether it needs to be updated on this form. But you're right, that's one of the challenges with keeping these forms up to date, and the regulated public also are talk about some of the, you know, the forms being out of date and not contain the most up-to-date information, because it does take a long time to go through the regulatory process.
Yeah, I didn't see a compounding section for the previous like community pharmacy, outpatient pharmacy, unless I missed it because it's just a one-liner. But I looked through it; they're so long. But in this hospital one, I'm seeing compounding referring to this other document. The one that's has been advised to use and has been in use at least by us is 17M39 revision 1 2022. and that's a draft approved January 2022. So I'm just wondering where is that one going? Because that's the one that has all the compounding questions. Is it being renamed? So I didn't see it in the list. Hi, Anne.
Yeah,
I'll
go
stop
ahead, Ann.
talking.
If I can just quickly note, we will, have a more robust discussion about this because it's kind of more related to the compounding self-assessment. But given the actions from the board yesterday, there's going to need to be significant change to like the broader discussion on the compounding self-assessment that really you can't really move forward with until the regs are done, if that makes sense. So just wanted to just like make that little call out. We can talk about it at the board meeting as well, but just wanted to just kind of like put that out there.
Thank you, Anne.
Hey, members, any other comments on the proposed changes to inpatient hospital pharmacy self-assessment? Okay, we're ready for public comment via WebEx.
This is the moderator, and we're open to public comments on agenda item 5B. If you'd like to make a comment, you can click on the hand icon, and that's at the bottom row of your WebEx screen. If you're on a computer or if you're on a mobile device, it may be behind the three dot other options, and call-in users can press *3 to raise their hand. There are instructions on the screen. Our first commenter is Keith Yoshizuka. And Keith, I'm going to send you a request to unmute your mic. You'll have 3 minutes with a 10-second warning. You're unmuted. Go ahead.
Keith Yoshizuka as an individual. I wanted to briefly address Chair Servo's concern about the labeling of physician dispensing in regards to the 3-day rule and the labeling requirement. Current California law requires that for prescriber dispensing that it meet the same labeling requirements as if something was dispensed from a pharmacy. The only thing that's exempt is that there doesn't need to be a prescription number, and that I believe is already in statute. Thank you.
Thank you, Dr. Yoshizuka.
And I do not see any further requests for comment. Shall I close that public comment feature?
Yes, thank you.
You're welcome.
Hey, members, are we, do you have any additional comments, or are we okay to go on to the next self-assessment? Okay, we're going to be discussing wholesaler 3PL self-assessment form. It appears that the only proposed changes are non-substantive, and I did not identify any additional changes. Members, do you have any questions or comments on the wholesaler 3PL self-assessment form? Seeing none, we're ready for public comment via WebEx.
This is the moderator. If anyone would like to make a comment on the issue, you may look for the hand icon and click that to raise your hand. Call-in users can press *3 to raise your hand. Are there any comments on this issue? I do not see any requests for comment. Shall I close the public comment feature?
Thank you.
You're welcome.
Yes. Let's move on to the automated drug delivery form self-assessment. Members, the board approved changes to the ADDS self-assessment form in April of 2024. The changes being recommended and are incorporated in the prior version approved by the board. So again, you'll see different versions on here. The new changes are the ones that are highlighted in yellow. As I indicated earlier, if the board is successful in securing the statutory change to establish self-assessment process in statute, I believe that some of these challenges with displaying changes over various versions will soon be addressed. Well, will be addressed, hopefully soon, but that's my editorial comment. Members, there are formatting changes being offered throughout the self-assessment form. In addition, you will note the updates to references are update to references. The non-substantive changes are again displayed on the slides to assist with our review. The first such recommendation change is clarification that the PIC for a correctional pharmacy may complete a single self-assessment under specified conditions, and that's what's being displayed on the screen. The next one is you will note that staff are recommending changes in 4.8, 410, 411, and 412 to highlight operational compliance issues regarding application and renewal requirements, as well as notification requirements. As a reminder, these are requirements in the law, and staff are recommending that the legal provisions be incorporated into the self-assessment form. Give you a second to look at that. Staff are also recommending changes in 6.3 to consolidate the related requirements. So small. And lastly, staff are recommending removal of section 9.3. This is because the inventory requirements are described in another section of the self-assessment form. Members, do you have any questions or comments regarding the ADDS self-assessment form? Oh,
I'm just going to make an editorial comment myself. I cannot wait for this to be in the statute. This is a little bit, I'm just gonna, I admire all the council and the board staff for working on this as well as you. Thank you, Chair Serpa.
yeah, that certainly would be a better service to our licensees also to have up-to-date self-assessment forms. Okay, I think we're ready for public comment via WebEx on the ADDS self-assessment form.
This is the moderator. If anyone would like to make a comment about the form, you may look for the hand icon and click that to raise your hand. Our call-in users can press *3 to raise their hands. Each speaker will have 3 minutes with a 10-second warning. And I do not see any requests for comment at this time. Shall I close that public comment feature?
Yes, thank you.
You're welcome.
Okay. The next self-assessment form is surgical clinic self-assessment form. Members, unfortunately, there was a problem in the accessibility conversion for the surgical clinic self-assessment form that was posted on the board's website. Again, the changes on the meeting slide are on the meeting slide, and I will review them verbally. So the one that's posted on the website did not show the track changes, but we're going to go through them here for the meeting. The first is a minor change in 5.8, where it is recommended to include, quote, or affected prescriber, unquote, in the beginning of the sentence. You can see the recommendation is also displayed on the slide there. I seem to recall that this was an issue that we discussed at a previous meeting of the board. The next change is in 6.6, which is a non-substantive change, again displayed on the slide. I think it's the next slide. .6, there it is. Okay. The substantive changes are found in 7.9, 710, and 711. This should be deja vu for you. Similar to my recommendations for the community pharmacy self-assessment form, I suggest that we simplify this language on the form to generally discuss the translation service requirement. If the committee is agreeable, I can work with staff before the board meeting to make this change. So we've had that discussion in another form, and it shows up here on this form. Members, do you have any questions or comments on the proposed changes to surgical clinic self-assessment form? My screen has changed, so I can't see hands anymore. So speak up if you have anything to say about the surgical clinic self-assessment form. Okay, seeing none, I think we're ready for WebEx comments.
This is the moderator. We've opened up the WebEx public comment feature. If you'd like to make a comment, you can click on the hand icon, and our call-in users can press *3 to raise their hands. Are there any requests for comment? I do not see any requests for comment. Shall I close that feature?
Yes, thank you.
You're welcome.
So bringing this to a conclusion here, this agenda item, if you are agreeable, the committee members, I can work with staff to update those 4 areas of the proposed forms consistent with our discussion today, and they will be presented at the board during the April 9th and 10th board meeting. Is that agreeable for the members?
Yes, Chair
I
Serpa.
can't
You
see.
don't need a motion?
Yes.
No, what we've decided is we're not going to do a board motion at the, to do a committee motion at the board meeting because there are so many changes. We will make the motion at the board meeting and update everyone on what the final documents say. So that's the plan for the April 9th and 10th board meeting. And I will work on my screen. Right now I can't see all of you anymore, so I can't see your hands. But not seeing any hands. I think before we move on to the next agenda item, it would be appropriate to take a break. Is that okay with everyone? So let's come back at 10:45. That gives us a little bit more than 15 minutes, but I think that we can use the extra time. 10:45. Thank you. Moderator Ann, I think we're ready to start. Are we recording?
Yes, we are.
Great, thank you. Welcome back, everyone. To confirm everyone is back, I'll do a quick roll call. Renee Barker.
Present.
Thank you. Sung Oh.
Present.
Ricardo Sanchez. Nicole Tebow.
Present.
Thank you. Ricardo, are you back yet? Let me look at the screen here. I'm hoping that he'll be here any minute here. We'll just, moderator or staff, if you could keep an eye out so that you can, or make sure that Ricardo announces his present when he returns. Thank you. Moving on to agenda item 6, discussion and consideration of petition request forms used for petitions for reinstatement of license, petitions for modification of penalty, and petitions for early termination of probation. The meeting materials provide background information on this agenda item, including the relevant section of law that establishes the general parameters for petitioning the board for changes in penalty or seeking reinstatement of license. As the meeting materials note, in 2023, staff made changes to the petition forms. Following implementation of the revised forms, it appears that there's an opportunity to evaluate the information requested and determine if additional changes are appropriate. As the chair of the committee, I had an opportunity to briefly discuss some concepts with staff in advance of this meeting. You will note that one potential change is to consolidate the forms into a single petition. I believe such an approach may make it easier for petitioners and ensure the board receives consistent information. I believe the proposed new form is a good starting place for our discussion today. I would appreciate members' thoughts about the possibility of updating question number 15 to include a request that the petitioners for early termination or petitioners seeking another type of reduction in penalty also list and provide proof of their CE related to pharmacy law, ethics, and cultural competency. Those are the required CE components. I'd like to hear.
And Member Sanchez is back.
Hello, Ricardo. Can you announce yourself?
Yeah, I wasn't able to unmute myself, but Ann helped me. Thank you.
Okay, great. Thank you. So with that, members, I am interested in hearing about your thoughts about the recommendations on the new form. President O?
Thank you, Chair Serpa. I appreciate you guys updating this form. I am happy to see this. I feel slightly guilty for not catching the forms were changed last year. And so I am happy that you were able to grab it, and hopefully we can implement this ASAP immediately effective for once we get full approval from the board in a couple weeks, we can make our petitioners submit this for all petitions starting in May and on. I just want to add one thing. I do agree with the proposed new form, making it one place. I just think that it is good to remind for question 16, we have list names, addresses, and telephone numbers of persons submitting the letters of recommendation accompanying this petition. Can we remind them that it requires 2 licensed individuals to submit it? So we could add that into that. The letters must include at a minimum 2 from a current licensed. This is where you can check with Corinne when we bring this up for the full board meeting in a couple of weeks. But I would just ask that we add that in there, whatever the requirement is.
That sounds like a great addition. Any other comments from members? Again, I can't see your hands anymore, so speak up.
This is Nicole, just to say I like it, and thanks to the board staff for making the updates. I think it looks more streamlined. I think it's going to be easier when we are reviewing petitions as well.
Thank you. Yeah, I don't hear anything. I can't see anything. So moderator, I think we're.
Sorry, Maria. I'm gonna just one more thing. In our current online form, we have a bunch of like FAQs listed. It's not on this document, but if you actually click on the link on our current form, they have like FAQs and the table of dates. I suggest that we take the table or any dates out of the PDF and it can just be incorporated into the website so that it's easily updatable and not in the PDF and all the cutoff dates or whatever that's there on the website. So that's another suggestion.
So that's on the website, correct? So that would be just a suggestion for staff to take back to look at the website links. Okay, that would be an action item for staff for that. Members, any additional comments on the proposed form? I think we're ready for comments for public via WebEx.
This is the moderator. If anyone would like to make a comment, you can look for the hand icon and click that to raise your hand. And our call-in users can press *3 to raise their hand. Are there any comments on this item? I do not see any requests for comment. Shall I close that public comment feature?
Yes, thank you.
You're welcome.
Great. So if the committee is agreeable, I can work with staff to further revise the proposed form to take into consideration our discussion today. And I'd like to present it at the board's meeting in April. As President O states, I think that it'd be nice to get it approved quickly. And if you believe that that's okay, I'd like to bring it to the board meeting with the 2 suggested changes. It will not be a vote because we're not making it a committee motion, but I just wanted to get the consensus of the board, the committee members, that we will bring it up at the board meeting in April 9th and 10th. Okay, thank you. Moving on, agenda item 7, discussion and consideration of enforcement statistics. The meeting materials include a summary of enforcement statistics for the first 8 months of fiscal year 2024-25. The board has initiated 2,099 complaints and closed 1971 complaints. As of March 1st, 2025, the board has 1,495 field investigations pending. The materials provide a breakdown of the average time frame for the various stages of the field investigations. Members, any comments or thoughts on the enforcement statistics provided? I can't see any hands, so speak up. I don't think so. So I think we're ready for comments for individuals via WebEx.
Thank you. And as a note, Chair Serpa, if you have the panelist list to the right side of your screen, raised hands from panel members will rise to the top.
Oh, they rise to the top. Okay, thank you.
You're welcome. So we are open for public comment. If someone would like to make a comment, you may look for the hand icon, typically at the bottom of your WebEx screen. Click that to raise your hand. And our calling users can press *3 to raise their hands. Are there any comments on this issue? I do not see any requests for comment. Shall I close the public comment section?
Please do. Thank you.
You're welcome.
Okay, agenda item 9, future dates. I'd like to thank everyone for your time and participation today. Our next committee meeting is currently scheduled for June 11th. Please monitor the board's website for updates. Also wanted to remind everyone that we have a full board meeting on April 9th and 10th, and I look forward to seeing everyone there either in person or virtually. And thank you, everyone, and especially thank you, Moderator Ann. I appreciate your help today.
Thanks,
You're
everyone.
very welcome.
Have a great day.
Thank you.
Bye.
Bye.
Thank you. Bye-bye.